Hey friends, this is Ian here at HIMSS 25 and I'm speaking with Anne Snowdon. She is the Chief Scientific Research Officer at HIMSS. She puts together all the scientific stuff behind HIMSS, all the thought, along with her team, of course. Let's welcome her. And welcome to the Futurist at HIMSS. What has been going on at HIMSS last couple of days? It's been very busy, extremely busy. Tell us your insights because you worked on putting it together. Tell us what's going on.
It's an exceptionally busy event, very dynamic, lots of debate, dialogue, knowledge sharing across, I would say, multiple knowledge domains. Industry coming together with clinician teams, experts, government, policymakers. For me, that's where innovation happens.
Yeah.
The opportunity to hear the multiple and very diverse perspectives in where are we in healthcare today, where do we need to get to, and how are we going to know if we get there, is really what these few days are all about. And it's like the fuel that then has the ripple effect throughout the multiple and different global networks to build that dialogue, find those collaborations, essentially becomes a global learning network.
Of course.
And that's what I see is so very valuable. No one has the right answer.
Yeah.
And what's right for one team, country, facility, organization, it's not going to be right for another.
Yeah.
But the diversity in views and experiences and expertise moves everybody forward.
Of course, and we've been hearing a lot about technology is a big pillar of discussion, innovation, of course, regulations, and many other things, which some are good, some are challenging, some are futuristic. So for me, honestly, we've had a lot of conversations here on the Futurist at HIMSS. It's been great getting all those perspectives in. We've spoken with some really forward-focused companies that are innovating unbelievable. I'm like, whoa, wow, that is amazing.
Yeah.
And then we've heard more about, where the US is with healthcare right now and what's happening with funding and whatnot. So there's so many different diverse aspects. I heard the keynotes have been great. Which has been your favorite keynote so far, or something that you were like, whoa, this is amazing?
The keynotes are so very impressive. I couldn't begin to say which one has been my favorite. I have to say I was deeply inspired by the Samsung Medical Center CEO and team really leading where digital tools, technologies can achieve such incredible impact for people. The technologies, those policies, all those pieces of drivers of system outcomes are impressive. For me, it's always about, so what is that achieving and for whom?
Yeah. And
how do we make sure everybody has that opportunity, which of course is the HIMSS mission vision.
Yeah. When you start putting a show like HIMSS together, there's a lot of thought that goes into it. Tell us, how do you do it? What do you do? Like this HIMSS is going to finish in a couple of days, and I'm sure maybe after a couple of days of taking that breather in, you're going to get started on the next one. What's your process? I want people to understand what goes on behind putting this thing together.
Collaboration would be the center point, and partnerships. HIMSS does not do this alone. It has key partners, but HIMSS really drives the content. It's a network of over 100,000 members. So where HIMSS has really been able to, I think, bring so much value and impact is mobilizing the insights. Over 100,000 members worldwide, as I mentioned a minute ago, to shape and to inform the learning so that everybody has that opportunity to move forward. Even though we all work within vastly different systems, where the US shifts and changes and funding models are, it's a very big market and it's a very big and influential country. Certainly becomes an opportunity to learning from other countries in Europe, Asia Pacific, and so on. So I think HIMSS, the processes are about building on the relationships we've cultivated over many, many years.
Yep.
Those key learnings, insights, directions, where is the future progressing?
Yeah.
That's really what feeds the structures, the speakers, the country delegations that we bring to this important event.
Of course, I couldn't help but look your bio up, see what you do, and what you've done through your career. And you're obviously a strategy person. You're an expert in strategy, and that you bring that to HIMSS. You've done that. You're also teaching, which is amazing.
Yeah.
And what I want to ask you is, with the fast shifting, fast changing environment that we're working in, all the healthcare providers, incumbents are in. What comes to your mind as advice to everybody on strategy? How do they pursue strategy in a fast changing time?
Yeah.
You may come up with something and it'll change next day, next week, next month, next year.
Yeah.
Help us understand what to focus on so that we can, and this is also non-HIMSS audiences watching this.
It is.
What's your take on strategy as of right now, 2025?
It's a great question. I happened to be teaching that class last night with my students. My best advice, particularly to our young members of our health workforce, is decide what's most meaningful to you. Decide what you're really good at, and learn from those people out there that can help you pave the way in making a difference in people's lives. So my entire career has been around, how do I mobilize my strengths and all the many strengths I don't have? Find the other people with those strengths and collectively moving towards solving a challenge that makes people's lives better, greater quality. So whether it's earlier days for me, how do we solve terrible injuries and deaths among children in vehicle crashes? And I worked with the automotive industry and helped them and mobilized their expertise and clinician expertise on keeping kids safer in vehicles.
Yeah.
Digital health, what does it need to achieve and for whom? We have many, many health challenges. For me, digital health is mobilizing those incredible technologies with the partnerships with industry, government, clinicians, health system leadership to ensure every person everywhere has access to health care and has an opportunity to achieve health outcomes. How do you know you're successful? You have to measure your progress over time, which is what I do a lot of with HIMSS.
Incredible. I want to ask you a follow-up question based on what you just told me. You've got a lot of startups that are part of HIMSS or not HIMSS. People are trying to invent something new, create something new, innovate and whatnot. Many times, and this is younger generation, I'm talking about personal experience, my family members, my kids, my nieces, nephews. Sometimes the younger generation is hitting a roadblock and they're saying, I don't know what I'm good at. I don't know what I want to do when I grow up. Or I don't know how to calibrate my direction to say, yep, this is where I'm going to go. And because you're an academic and an expert who can really touch the hearts of people and help them, guide them, how do people focus on what they're good at? Is it a process of iteration? Should they do something 10,000 times and then figure out, no, it's not for me? Just want you to guide audiences who are confused about what they're good at, and then they can start thinking in that direction.
That's such a good question. And it's surprising how often I get asked that question. And I'd have to start with, there's no magic formula. So many times my students will say, I don't know what I really want to do. Well, one of the ways you can figure that out is try things. You really quickly figure out what you never want to do again. Yeah. We've all done that, right? Yeah. We thought we would be excellent at that particular clinical practice. For example, for me as a nurse, I worked with those patients. I've decided I can't be as successful for those families, but let me try this group over here. So sometimes it's trying things on for size. That would be one. A second thing is find people with completely different expertise and background than you have. So if you have an undergraduate degree in business, and you're not sure what business is huge, you're not sure what business sector, go and work with a computer scientist. Figure out what they know that you don't. Spend some time with a health professional. What's that world look like? Spend some time with an engineer. The diversity and exposure to different career paths, different career opportunities helps you understand, what's meaningful to you. It's about your meaning system. Our meaning systems come from what experiences we've had. If you haven't had many diverse experiences, you're not going to know what's out there in the world.
Yeah, of course.
Be brave, be courageous, and work with people that you find interesting, inspiring. I used to, as a young student, looked for people that scared me.
Yeah.
Because I wanted to understand, why am I nervous around that
Yes.
person, and learning from them.
Incredible.
It's about learning.
Yeah. No,
And putting yourself out there and trying things on for size.
And
There's no magic bullet.
we all need to do that.
Yes.
And you know what I've observed? I talk with a lot of people through my work, and from the most basic to the most senior people,
Yep.
and everybody internally has the same anxieties, same fears, same desires, and we all are the same. But I think what really separates us is what you just said, is you've got to have that tiny bit of courage that'll take you to the next step, and somehow something else will drive you forward. So don't think about climbing the mountain,
Right.
but take the first step,
Right.
and then begin that journey. I think it's really important, and
I
I
think so
completely agree with you on this. That's what I do all the time,
Yep.
is take a small step, and then something else will propel you further, because we cannot see into the future, but we can trust that your beacon will guide you, your mission will guide you, and you'll find the right people and connect with the right people.
No question. What I also see often is people don't look in the mirror very often and acknowledge, I'm pretty good at that. I actually felt like I achieved something. You got to do that. You got to really look and say, what am I really passionate about? I want to make a difference. Then you go after it. That's the courage part of it. Be passionate. Find what you love. And you don't know, it just doesn't jump out at you, it doesn't drop out of the sky.
Yeah.
Have to spend lots of time, different environments to learn what that is.
Completely agree. Thank you so much for spending
My
this time
pleasure.
with
Thank
us.
you for those great questions.
Thank you. We really appreciate it. Have a blast at the remainder of
so much.
HIMSS 25, and then we'll catch up with you next year. And keep innovating, keep doing the good work that you're doing.
I look forward to seeing you again.
Thank you so much.
Thank you so
Anne.
much.
Thank you.
Bye now.
Thanks, guys.